the vast majority of Māori whānau don't have violence within it, but for those that do, they are disproportionately represented in child abuse and neglect statistics, violence against women, and there's also evidence to say our men have also been involved in some sort of victimisation, often as a child or a young person. It is a really worrying thing that we have, and that seems to be quite resistant to change. There are a lot of systemic and structural issues that make it a difficult problem to resolve. It is an intergenerational health issue, and we have some whānau where there are multiple generations of violence, and some of that is related to the colonisation of New Zealand and the consequences of that, and those really important support systems disappeared. So I think within our whānau and hapu, it's important to remember that pre-colonisation there is evidence to say that it was a public issue. If there was any transgressions, they would be dealt with quickly and swiftly. As one kaumātua said to me, our fences were our tikanga, our values and practices that kept us safe. But with colonisation, we moved from the unseen fences into the seen fences. And I think that's a really good analogy to use, because the violence affecting our whānau moved from a very public arena into a private arena, which makes it difficult to address. Tū Wāhine, Tū Whānau is a Marsden-funded research project where we looked at how Māori women keep safe in unsafe relationships. And it sort of originated out of my growing concerns on the Deaf Review Committee that oftentimes Māori women were framed in a specific way that had almost a dominoes effect. So, one person would say something and then people would act accordingly down the track. What was really concerning is that these women were seeking help and assistance, but weren't getting it. Oftentimes that request was being documented, but nothing acted on. We did this study, and we interviewed a wide range of people, predominantly Māori women. We included some Māori men, we included young Māori women, and what have you. And we found that they were using a lot of strategies. Those strategies enabled them to keep safe. They knew their partner and their partner's behaviours and things like that, so tried to minimise outbursts of violence, but at times that didn't work. So it paints a different picture around these women, and our subsequent research as well reinforces the notion that these women they come with a lot of strengths, and on which we can engage and build on strategies. So that's quite important that we remember that. A growing concern that we had in this research were the multiple accounts of women talking about blunt force trauma to their heads and non-fatal strangulation to the point of losing consciousness. And none of them were followed up by health professionals, which is somewhat concerning. I think this also accounts for some of the inconsistencies in stories, sometimes stitching things together to make a coherent story. So we often see Māori women being criticised because they can't get their story right and they can't get it consistent. But I think we need to always remember that for some of them, they experience significant violence. But we also, this also sits within our tamariki as well, can be exposed to that physical violence, but just even growing up in the environment, particularly early in life, has long-term consequences for their well-being. Health is a window of opportunity because most families in whānau will engage with health services long before they come to the attention of police or justice services. So it needs to be considered as an opportunity to engage with our whānau. I think it also needs to be put into the context that our whānau oftentimes don't trust health professionals and health services, and that's over a long period of time. There's a difference between saying kia ora, my name is, to just going straight into doing the business of health service delivery. So that short period of time spent engaging with somebody is really important, and it helps decrease the barriers that women often come with these walls built up. What can we do with the window of opportunity? I think first and foremost is greeting somebody. What we've found is that the difference kind and caring people make to the outcomes of their interactions is huge. A lot of assumptions are made around what is going on for them without even having the conversations. So introducing yourself, saying who you are, and asking, how can I help you? Are you being safe? Are you safe at the moment? I'm concerned about your safety. What plans have you got in place for your safety and that of your children, and how can we help you? I think it's useful to remember that these women are experts on their level of safety, so we need to listen to what they're saying and be guided by that. This week, dealing with the violence might not be in front of mind, but next week or 2 weeks or a month later, it may well be. Those people who've made an impression can be seen as safe people to go to. So I think that's really important. But if we're not asking the questions in a respectful and gentle way, those walls that our whānau often enter health services with remain up, and there is this sort of pushback and resistance. Our research shows that all the Māori women that we've interviewed want the best for their children. I just heard a couple of weeks ago about a mother who had a 15-year-old son and was denied entry to a refuge because of the age of her son. And she said, I wasn't going to leave him alone, so we were homeless and on the streets. So, they're dealing with a lot of complexities, and it's easy to sit on the outside and judge, but they're trying to do the best they can. I think it's really important to recognise that, to begin with, none of those women's relationships were violent. Over time, things, unfolded and the violence started. And then eventually the controlling behaviours, the manipulation and what have you. Health professionals might be the people in their lives that can make a difference. There's a need for a really good understanding across the board that violence is a health issue. Living in a violent relationship creates long-term health problems that people end up. They might be physical health problems as a result of injuries or more somatic health problems, or they may well be mental health problems. The longer people are having to live in those environments, particularly children, that's going to impact on the future of our people going forward. Health is a really important part of the system, of the family violence response system, to intervening and getting people the help that they really need. Your primary care healthcare centre, maybe the ED, because a lot of our whānau end up, presenting at EDs, are really good places to start. Well child tamariki ora, again, is another area of just engaging, developing relationships and listening, and then working with our whānau about how they can resolve the issues that they've got at the moment, get the right help that they need. We need multiple forms of change. It's not just individuals who work in the different services. It is a systemic change that begins with really robust policy, and we've got Te Arariri Kura now that is the national strategy for the elimination of family and sexual violence. Our Minister for the Elimination of Family and Sexual Violence has got advice coming from a tangata whenua advisory group who advises the Minister as well, called Te Pūko Tahitanga. So that policy is really critical, but then the implementation of the policy and the services. We can't forget in this equation our Māori men, because often they have grown up with violence, not all of them, although the Māori men that we've included in our research who haven't grown up with violence have talked about being sexually abused. So they've had some sort of exposure to violence. We can't keep demonising them all the time. That makes it quite challenging at times because they are part of the whānau, but that's why having Māori providers of services, kaupapa Māori providers, is really critical, because they know how to navigate that landscape. But if we expect change, we also need to work with the people who are using the violence and recognise their stories, which are really real, and then work around how they're going to get in front of that. It's not about fixing the problem we're not asking health professionals to do that, but it is actually recognising people and giving them the information that they can act on when they need, or referring them to people that are going to help keep them safe. Really taking a little bit of time to find out what's needed and what support is needed. You might be the one person in this person's life that makes a huge difference, and that's about capitalising on that window of opportunity.